Hospitals have changed how they look at their inventory overall. It used to be hospitals kept low stockpiles of things like oxygen and other medical supplies and could order whatever they needed whenever they needed it. But that's not the case since the pandemic began. Our Jay Burr live at Baptist Hospital tonight. And Jay, how are these hospitals dealing with these supply chain issues?
Well, it is a complicated web to weave for them as well, because they are constantly shopping and trying to acquire the things that they need. And it's a little more complicated than for you and me, Laura, who can maybe just find the latest lightning deal on Amazon. When COVID cases go up, hospitalizations eventually follow, which means more work is being done in hospitals across the state.
So we are using more masks than ever. We're using more gloves than ever. We're using more isolation gowns than ever.
Lisa Farmer handles the supply chain for Baptist Health. She's in charge of procuring everything in a hospital, from PPE to implants to the gases used like oxygen. And they are not immune to supply chain issues.
I kind of look at my job as a roller coaster ride every day. I never know when the curves are coming, or when the dips or the high drops. It's everything.
She has deals in place with manufacturers, but there are times when supplies are still limited. She tries every avenue possible, but avoids things like Amazon.
And that's the last thing we want here, is to have counterfeit or gray market items, because again, patient focus. And we do not want to put any patient at risk.
When supplies do get lower, she meets with folks to see how they can stretch it if they can. Farmer also said there's been a focus to reuse certain items more, like bed linens.
I think that's going to be the focus for at least the next 2 to 3 years, probably, for supply chain. It's just going to be something as simple as sustainability.
She's constantly wheeling and dealing for supplies, even for things beyond COVID care. And anytime she can acquire a need, it's usually a short celebration before the next challenge presents itself.
So do I ever take a deep breath and think I can kind of relax? I haven't found that place yet. I'm waiting on it. I'm hoping that maybe this year I'll be able to.
Now, Farmer also said there is a pretty good spirit of cooperation amongst all the hospitals here in Arkansas. She also said that Baptist doesn't necessarily hoard supplies. They get what they need, and they do have a stockpile, but they have also donated masks to Little Rock School District, and they also do help some of the smaller, more rural hospitals in the state if they do ask for some supplies that they maybe can't acquire. But for now, live from Baptist Health here in Little Rock, Jay Burr, KARK 4 News.